Welcome to Yakut International. In this section, we are going to discuss the question and answer of the Oman Pearson View Nursing Examination. This is the topic-wise discussion. Today, our special topic is ethical nursing. Okay, it's a very important topic. Let's see the question and answer with the rational one by one. Okay. So first question. The nurse is preparing to give an injection to the patient. The patient refused to get medication. Then the nurse forced him and gave the injection to him aggressively. What is the description of the nurse action? Okay, so this is the question. So in the option, there is assault, battery, abuse, malpractice. If you know what is assault, if you know what is a battery, then only you can able to answer. So let's see that, so that if any question come, you can easily answer. Okay. So intentional torts. Under the intentional torts only, we have assault and battery. What is intentional tort? It is willful acts. Okay. It will be violate the client. So what is the assault? A and B. Remember, intentional tort. Under that, A and B, assault and battery. What is assault? The threat of harm, any threat made towards a client. Okay, threatening. Okay, so you know threatening. What does that means? Okay, if you do that, I will do this. Like that, we will be using to threaten the people. That is called threatening. Okay, so verbally threatening will be happen. That is called assault. Okay, got the point? Example C, I will restrain you to the bed if you keep getting up. The nurse is telling to the patient, I will restrain you to the bed if you keep getting up. Okay, that is a threatening from the nurse to the patient. Okay, it is assault. Understand clearly? So any type of situation come under assault, you can able to answer it. Okay. So next is battery. What is mean by battery? It is the act of armed physical act. Remember, there is only threatening assault, but the battery, there is a physical act is happening. Okay. So physical act that will be the cause the harm. Got the point? Harm to the patient. It will be very easily. Example will be performing a procedure without consent. Okay. I'm just going to do, the doctor is going to do the LP for the patient without the consent. What will be happen? That will be the battery under. Okay. And one more example, giving a medication that the client is refusing. The client is telling, don't give this medication, but the nurse is giving that medication very aggressively, just pushing to the patient. That will call under the battery. Okay, got the point? These are come under battery. Okay, so let's see the question. The nurse is preparing to give an injection to the patient, but here the patient is refusing, but the nurse is injecting aggressively, forcing him to injecting aggressively. So this is the example for what? It is a battery. Okay, answer is battery. You can clearly understand now. Okay, let's see one more question. Medical ward, patient have the anorexia. The nurse threatening to place a nasogastric tube in a client who is refusing to eat. What is the description of nurse action? Okay, here, the previous question, there is the act, physical act, forcing him and injecting the injection to the patient. Okay, here, only the verbal. Okay, see, not eating, so just giving, telling the patient, the nurse is telling to the patient, if you're not eating, I will just insert the nasogastric tube, NG tube. Okay, this is the threatening. So what will become? What is the answer? So verbal threatening is assault. Okay, so answer is assault. So don't forget this one. Okay, so these are two main things in the ethics. Assault means verbally threatening. Battery means it's physically harm. Okay, so these are the two important things you have to remember. One more example. So the X-ray technicians is coming to the ward. Okay, this is one of the another question, important question. So X-ray technician come to the ward, ECG technician. Okay, so bed number 4 is booked for the ECG. So the technician went inside and just removing the patient shell. That is correct or not? No, it's the come under what? Battery. Without the permission, without the consent of the patient, without informing the patient, just going and removing the burdens of the shared of the patient. Okay, that is come under BAT. Okay, remember these are the almost situational questions. So these two is very important, assault and battery. So if you will get definitely question from assault and battery. It is very important topic. So remember these so that you can apply in any situation. Okay, got the point? So in further class, we will be seeing the more question and answer system by system. Okay, in the Yakut International, there is the online training will be available for Prometric, SNB, MOH, THA, HAAD, and the OET and IELTS. Okay, so Yakut International, anytime you can contact.